Howdy everyone, it's great to be reporting from Atlanta, Georgia, where I've been presenting our mental health series at the Carter Presidential Center as a Rosalind Carter Mental Health Journalism Fellow. And tonight we have another episode, this time highlighting the efforts to address mental health issues on Tinian.
A lot of the students experience trauma, and even just hearing the strong winds would trigger a reaction in them, but they wouldn't even know. A lot of them didn't understand why. So that's why we provide groups to the students that might have experienced trauma from that, not just from the typhoon, but also the pandemic. And we work with them to understand how their thoughts and feelings relate to their reactions and how to cope with that.
Two mental health specialists from the public school system on Saipan visit Tinian every 2 weeks for a day to speak with students learning how to heal from the mental health toll of recent typhoons and COVID-19. There's no licensed therapist living on island, but some students are able to get the help they need through telehealth. Campus can sometimes be their only reprieve.
A lot of us either lost our homes or lost a lot of things with that typhoon. And it affected us a lot, but we kept it to ourselves during that time, kind of just learning how to deal with it on our own. And then once we came back into school, it felt like a bit of normalcy. So when the mental health program started reaching out about how the typhoon affected us as students, I felt appreciative of it because it helped us actually, take a moment to sit back and process what happened.
The mental health department provides group counseling, targeting students who might share similar experiences off campus.
The trauma from the typhoon, the trauma and anxiety related issues from the pandemic really was just an accumulation of prior trauma that they've already grown up with. We in addition to just U2, we had Sodalor as well, and then we also financial concerns at the home. That was some of the things that we saw the students reveal that was heavy on them.
There's also the stigma. A lot of the students I've experienced where a lot of students do want to receive services, but they kind of get some pushback from their parents because they feel like only people that are mentally ill or that are in institutes need mental health services.
The program wants to build mental health literacy and break away from a culture of silence.
Having our students and even our school staff have regular and immediate access to mental health care. I think for me that's what I would like to see. Someone housed on the island specifically dealing with the caseload and the community.
We will have more on our Mental Health Matters series every Wednesday. Tomas Maglonia, KUAM News, Atlanta, Georgia.